Hey everybody, welcome to chapter 14. I'm going to do this on Zoom, clearly, you can tell that already. So you can download it and, well, you don't have to download it, I guess that's a better way of putting it. So what are we talking about here? We are talking about prevention of chronic diseases, how that relates to both physical activity and healthy eating. So we recognize that chronic degenerative diseases have overtaken infectious diseases and cause of death. It used to be tuberculosis and pneumonia would take out large chunks of the population, but now cardiovascular disease, cancers, chronic respiratory diseases, and stroke are all leading causes of death. So interestingly, we should be able to affect some of that. Can we delay or prevent them? Can we address the risk factors and control it? So what are risk factors for chronic diseases? We have both genetic, environmental, and behavioral risk factors. So genetic, our age, our gender, our race, not necessarily things we can control after the fact. Environmental, we can have different physical factors, socioeconomic factors, family factors that can influence it. And behavior, what do we do that increases our risk? Smoking, our poor eating habits, being inactive. So if we look at this from a pictorial again, those inherited or biological risk factors, not necessarily things that we can control. For the environmental and behavioral, we do have some. Environmental, we can have physical issues. We can have poor air quality, water pollution, lots of noise, unsafe highways. All of those things are going to be a little bit more physical. Socioeconomic, what is the state of income? What kind of stability do we have with housing? What's our employment status? What's our education status? Family, what kind of stress do we have there? Divorce, death of a loved one, children leaving, what kind of family stress did your going away to college put on your family? Or this particular year, you're not going away to college, put on both you and your family this year. And behavioral things, smoking, the vaping, being inactive, poor nutrition, overusing medication, drinking, all of those things will play a big role. When we start looking at chronic diseases, there's not going to be an A created B situation. There's going to be a lot of factors at play. And so we look at that as being a web of causation. It's not one thing, but if we have to look at this, how do these things, how are they complex? How are they involved? And we're going to see overlapping risk factors. So when we look at epidemiological models, we look at cause, we look at this web of causation as being the actual response. So when we look at this, the genetics are going to be there. Can't really stop them. They're what we were given to start with. But, how much access to high fat, inexpensive food do we have? Does that diet high in calories and fat content lead to obesity and being overweight? What play does smoking have on our hypertension being related to being overweight and therefore becoming type 2 diabetic? All of these things are going to be a huge, huge component. If we're looking for outside exercise, we're not necessarily looking at a gym-like setting. What kind of bikes and trails and sidewalks do we have? Do we have those things? All will play a role. So we know that coronary heart disease is associated with atherosclerosis, right? The thickening of that inner lining of our arteries is going to be a major contributor to heart attack and stroke death. So anything that has a disease of the heart and blood vessels are going to lead to that heart attack and stroke. So, having multiple risk factors is going to magnify that risk. But by the same token, eliminating or decreasing a risk factor should also help reduce the risk. So, if we look at coronary heart disease, according to the ASDM, these are our risk factors. Age and family history, can't change those. They are what they are. But the cigarette smoking, the being sedentary, overweight, being hypertensive, having high lipids, and being pre-diabetic, those are all things that we could maybe affect. But those are all going to be what are considered to be risk factors for coronary heart disease. So if we look at physical inactivity, because, we're in exercise phys, as a major risk factor, it is an independent risk factor. Sitting is the new smoking, right? And you've heard that said. So that relative risk of coronary heart disease due to inactivity is very similar to being a smoker, to having high cholesterol, to having high blood pressure. When we look at that, it's a huge population that has attributable risk because we have a lot of inactive individuals. So let's take a minute and from an epidemiological guideline, how do we determine risk between these factors in disease? We have to look at a lot of different things. We have to look at the temporal association. What's the timing effect? Plausibility. Does it make sense? Consistency. If we look at different populations, are we seeing the same associated risk? Strength of association. Having a size 8 sneaker, does that make sense? What's the strength association of that? Is it plausible? We have to look at the dose response relationship. Are we looking at inactivity or mild activity, moderate activity? Reversibility. If we're inactive and become active, does our risk change? If we're looking at these study designs, do they make sense from a statistical point of view? And then we have to judge the evidence that we're seeing. All of these things are going to help be necessary to determine what kind of association we really have between risk factor and disease. So if we look at this, 10% high blood pressure, 10% have high cholesterol of our population, 18% of our population smokes, almost 60% is inactive. That is huge. That's one of the single biggest things we can affect that makes sense. So if we look at causes of all mortality, we are going to see that the more activity we do per week, our relative risk decreases pretty significantly. Almost 40% from doing nothing to being active 7 hours a week. That's huge. So let's break down atherosclerosis a little bit more. We know it's inflammation of the inner lining of the arteries. That's a response to tissue injury. So we start to recruit leukocytes. We're going to see lipid and fibrous plaque in the lumen. We're going to see those coronary arteries narrow, so we're going to have less blood flow. And at some point, we'll rupture that plaque, form a clot, and that is the cause of most of our heart attacks. So if we look at it, we activate the endothelium with monocytes. Macrophages are going to scavenge LDL cholesterol. We're going to see smooth muscle and connective tissue form those fibrous plaques. And then overall, inflammatory signals will trigger that plaque rupture, leading to our clot. If we look at obesity being related to inflammation and therefore chronic disease, we're going to see a low-grade chronic inflammation. We're going to see adipocytes secrete more cytokines. We're going to see visceral fat secrete more inflammatory cytokines. And we're going to see an increase in that C-reactive protein, which is going to be our marker of inflammation. So here's just another pictorial. We'll see all of these things happening in those blood vessels and at the cellular level that come together to see that increase in that fatty core with a rupture and thrombus dislodging and causing our heart attack and stroke. What can we do? Well, let's start at the bottom. Being physically active and being fit will lower our inflammation. Right? Eating a Mediterranean diet of fruits, vegetables, beans, and grains, and olive oil also will reduce that chronic reactive proteins. Medications, statin drugs will help lower LDL-C and our CRP. So therefore, we can reduce cardiovascular disease and death. Let's take a second here and talk about statins, especially related to activity. Statins are known to weaken tendons as a major side effect. So being active or even just walking, having been on statins for a long time, you may see a weakness there. These are the populations of individuals who just walking up the hallway of their office rupture an Achilles, pop off their bicep tendon, slip, have a patella tendon rupture. So just recognize, yes, it might have helped you cardiovascular disease and death, but you may blow a tendon while you're at it. So what does exercise training do to reduce this chronic inflammation and obesity? Lots of things. You know, overall, exercise is going to help decrease that systemic inflammation. So we are going to see muscle tissues have more anti-inflammatory cytokines and decrease pro-inflammatory cytokines, right? We're going to see adipose tissue decrease hypoxia, increase blood supply. You're going to see endothelial cells have more cellular regeneration and decrease those adhesion molecules so things don't get stuck. We're going to see immune system cells increase our regulatory T cells. All of these things together are going to lead us to a lower overall systemic inflammation. When we start talking about metabolic syndrome, and I'm not going to go through this at length because you know that all of your other classes will also have gone through them at length. But we know that individuals that have 3 or more of the following risk factors are considered to have a metabolic syndrome. So we're looking at abdominal obesity, high triglycerides, low HDL, high blood pressure, and high fasting blood glucose. I would tell you to start the slide and make sure that you recognize it so that you know what those factors are for the metabolic syndrome. So looking at this, in the last decade, metabolic syndrome has increased in the US. 36% of adult women and almost 30% of adult men suffer from metabolic syndrome. That's a pretty big number. So, you know, there's going to be 2 competing hypotheses to what causes it, though they're not mutually exclusive. There's probably some overlap. One is going to be increased oxidative stress. We're going to see increased production of free radicals that cause cellular damage and inflammation. Or we're going to see a low-grade chronic inflammation leading to obesity and type 2 diabetes. So both of those things are probably together causing this cardiovascular metabolic syndrome. Right? So here's just a pictorial putting these things together for you. And what do we want to do with them? Well, we want to be regularly active. We want to have a healthy diet. We want to reduce weight, perhaps managed with medicine, so we can reverse that metabolic syndrome and decrease our risk factors for our type 2 diabetes, our atherosclerosis. You know, overall, we want to decrease our MI, ischemic stroke, and PAD. So here just puts it together, but I think it makes it a really nice pictorial so that you can remember. So again, my guess is a lot of these things are what you would have had before in other classes, but ties it together for this. I'll see you next time.